Uh, Namaste all. I'm Smita from Bangalore. Hope just you guys know the name, but let me introduce by myself. Then I'll get to know about everyone. Then after that, I'll explain in this course detailedly what you guys can learn full. Am I audible? Am I audible? Only I'm seeing one or two videos here. Vasundhara. Please switch on your videos, then it will be easy later to convey. It will be easy. So main points we can discuss and all. Okay. Hope you are able to see me, right? Uh, I'm teaching yoga from past 14 years. My journey started at the age of 6 years. I'm total 16 I have like 16 uh, times national winner. I mean, 2007, I'm the last winner and all. Then, due to my personal things, I didn't participate in yoga competition and all. Like 3 years back, I lost my husband. Then family issues and other things and all. And coming to regarding prenatal, before prenatal, I had done my MCA, then MA, MSc, and present I'm doing PhD. I'm the first Indian lady of doing PhD in pregnancy yoga. This topic only. I'm the only one from the India, so it's getting time. But I guess in another 6 to 1 year, I would finish. Till now, 168 cases I had drafted for pregnant women how to deliver in a normal way without any stress free. Throughout the world, my number is 64. From India, I'm the only first Indian lady. Means like in yoga, so many other things will be there, like high BP, low BP, thyroid, and different issues, right? My topic is prenatal. And suppose the bridge baby, think like 30th week or 32nd week also, with yoga techniques, how we are going to turn the baby position in anterior and posterior to deliver a normal thing. This all later we are going to learn. Just I'm giving an introduction of my introduction. Coming to the point of prenatal, this August comes 10-year experience for teaching for prenatal yoga, handling clients and teaching training for the prenatal and all. And this is my introduction, which I want to say in a short way. Regarding the course, what all topics we are going to cover, what are syllabus we are going to cover, and in depth, all the topics means how many asanas you are going to learn, complications. These all again I'm going to say. Once we started the classes, then anyhow you'll get to know about me in detail in a proper way. So I'm from Bangalore. I forgot to tell that one. So now, and from this center, I'm working from past 5 to 6 months. Earlier with different institutes also I used to work. For this center, I'm working for prenatal. Another one, two centers, I'm working for infertility topics and like harmonic imbalance, PCOD and all. So now please switch on your videos. You can pick, give your introduction in 1 minute, like which place, like if you're a yoga trainer. So just for introduction, so we'll get one idea. Then I'll give the difference between the Garbha Sanskara and prenatal and postnatal. What we are going to learn this 1.5 month or 2 months, everything I'm going to explain. Okay. Tomorrow onwards, we can start in full. But today I'm going to give a detailed picture and who all there in the group. I'm going to share one PDF which I have drafted by me. In the prenatal, total 82 asanas I have drafted. But that doesn't mean like a woman can do that 82. If no complication, pakka you can handle it. Okay, complications like 14 I have drafted in different ways. But in classes, you will learn. Suppose like IVF, IUF, lower placenta, then they can't do asanas, right? The topic is different if it is IUF case and all. So what we have to do, what? And in this course, you're going to learn 82 asanas for pregnancy, okay? But who all are there in the group? Now, after the session itself, I'm going to share one PDF, the total 135 pages. Please download or take printout. It will be add up. When I start asanas, only one thing you can note it down, like which week you are going to start. Suppose that poster we are going to start on the 14th week. We have to stop by 23rd. Only that one point you can add. Why I didn't mention in the notes in my PDF means it depends to person, means anterior, posterior, baby positions are 8 different positions. So based on that and health issues, suppose in pregnancy, diabetes will be there, thyroid will be there, hypertension will be there, stress, not only pregnant women, general also will have different issues, right? Based on that, these weeks here and there, 1, 2 weeks, we're going to change. That's the reason these 2 points I didn't mention. Okay, if you will take printout, just it will become easy to note it down. Actually, total 6 PDFs are there. Slowly, I'm going to share. If total all 6 PDFs, if you do this much big book. Okay, first right away after the today's session, I'm going to send you asanas ka, prenatal ka. Okay, in that all 82 asanas will be there with steps and benefits and picture of my sister photos. Okay, after that a short description regarding like pranayam, breathing techniques. That is most important, right? But I'm going to cover 20 pranayamas. In that I have given a general kind of thing, 6 or 8. Okay, don't miss, anyhow recordings will be there, so you no need to worry in that. But there I gave a list of mudras, hardly 10 or 12. But in sessions, suppose in pregnant lady have fibroid in pregnancy, think, or diabetes plus hypertension in pregnancy, how you are going to give? They can't do few asanas. Then what we are going to do? Like Makara Mudra, Matangi Mudra, Apana Mudra, Apana Vayu Mudra. So mudras, I'm going to teach you 30 mudras. Okay. But notes wise 64 mudras, I will give you PDFs. So everything I will send you through WhatsApp. If you want personal, you can text me in a group. I am also there. So you can text me your mail ID. So I will mail you. Either or you can. Okay, fine. Then theory also I have mentioned there, before pregnancy, what like complications and reproductive system benefit and procedure, and then each trimester, like first one, second one, third one also, physical changes, mental changes, spiritual changes. We'll talk and we'll discuss about this today itself. Like outer, tomorrow I'll go depth. In meanwhile, if you switch on your videos, we'll have introduction. My left side here, full colorful t-shirt. You, if from you it is in like a yoga background, please let me know how many years experience or from which background and which place your name. So when we have started practical classes with me, 1 or 2 members will do means, then I keep on like interacting ways, it will go down. Then if you start doing your assignments also, it will become easy to identify your faces. That's it. Okay. Any doubts you can ask me. Okay. Ma'am, can you unmute yourself?
Hello everyone. My name is Vasundhara Sharma. I
We
did
can call you as Vasu.
Yeah, you can call me Vasu. That's fine. I really don't mind it. I'm actually from a psychology background, but
Oh,
1 year ago I decided to switch my career. Although I like you, I did not participate in so many national competitions, but I've gone for few, for 3 times, and then I've been teaching yoga for 1 year and so. And yeah, I teach between beginners to advanced level.
okay.
This is pretty much of it what I can tell as of now. My I was getting clients who were pregnant. I did not take their classes because anatomy again it is very different than the general clients. So
Like
that
Hatha Yoga, Ashtanga.
yeah, I can teach that. I teach the Ashtanga, Hatha Yoga, and Vinyasa.
Okay, one more thing. Sorry to interrupt you,
Yeah.
Vasu. If anyone are interested, 3 years back for one website, I have wrote 28 health issues of diseases. Suppose asthma
Mm,
or hernia or different kinds of health issues.
mm.
In Google, you will search, but you will get to know. But in which way I drafted for any health issue, the main problem is what we should know about the root cause. She's
Yes,
a
correct.
psychologist, so I was just pointing out.
Yeah, sure.
So in which way I mentioned, I was telling, if anyone are interested, if
Mm.
no problem, I can post that from my rough copies in the group only. If anyone
Yeah,
interested, I will share personal. You
yes.
can print out why means 28 health issues in which way we drafted means any health issue. General example I'm going to give so you will understand. I don't know you guys, right? So maybe you have some area you are better than me, so I will also get to know. Okay, just I'm sharing. In which
Sure, sure.
I wrote means the problem, cause, effect, symptoms, risk. Means just we should know. Suppose thyroid. So what all? Means it will work with your pineal and pituitary gland. If you
Mm,
link with yoga, we'll say like Vishuddhi Chakra. Then Panchapranas, what we have to link? Udana Vayu, air is traveling upward. So what kind of asanas? Each
mm,
topic I have wrote like introduction, symptoms,
yes.
cause and effects, risk factors, precautions, contraindications, then asanas, not more. Why means once they like my book, definitely they'll ask. We have a team of 4 to 5 members here. So asanas like 15 to 16, pranayamas and mudras. So it will
Yes.
be helpful. If you want, let me know. I can share in the
Sure,
group.
sure, definitely. Let me know.
Okay, Vasu, continue. Vasu, sorry.
That was it. Nothing much to
So
add on.
okay, one more. So
Yeah.
everyone will add this point also. Why you joined this course?
My that's what I said, because I was getting clients who were mostly
Oh, for
pregnant.
pregnancy or before, like
Pregnant.
they're planning to pregnant. I mean, like the
Yeah,
process.
they're planning to, they want to, and like post the delivery and all.
Oh,
So usually my class includes of Ashtanga Vinyasa flow only. So I am more into strength training and that other things. But
okay.
this is something I cannot force them to do it. So I have to know the proper anatomy of a woman, like, because I did not get married, so I don't know how
Oh, so young.
here and there. So I have to like understand it very carefully.
Ah, yes, very good. Suppose she's suffering with PCOD and she want to become a pregnant,
Exactly.
what to do? Otherwise, everything is good, but she is not able to conceive. Right?
Correct.
And suppose if not, like egg fertility is very less. 4.
Yeah.
Increase. If age of 40, if egg fertility is 8, then super. But age of 30, if egg fertility is 5, then what to do?
Yeah.
So we are going not 1 second. Let me place my screen only. Then I'll go with other.
Yeah.
See, in this course, anyhow, this topic came from Vasu, so Vasundra. So I want to add one more thing. First, I'm going to cover, you let me know. Earlier 4 batches I had done in one way. If you want to change, let me know. I will go in another way. No, in the same style you want, you can opt it. I will, based on that only I will go. I want to cover in which way means prenatal at a stretch theory. If I teach, you guys will feel bored means after 3 classes, at least theory you should know little bit. Like I'm going to tell you one by one after your introduction. Then we'll finish entire prenatal ka topic like 82 asanas, 20 pranayama, 30 mudras, and you're going to cover 12 meditation also. Meditation list I'm going to tell you. By listening that, you will feel like wow also how a mother can change the baby's mind from the pregnant from the womb itself. Okay, I will tell the whole headings. Once this is done, then at least few people will have confidence to okay, we have done this much. You can start writing case studies. What I'm going to, what experience I have, like I deal with so many clients. So like 28 questions are there. You can pick any one case study, like 22nd week pregnant lady sciatica pain. Otherwise, 18th week pregnancy, like diabetes. Any one case you can pick. You can start drafting. So in meanwhile, usually what I had done earlier courses, I'm telling you. In meanwhile, I'll start before pregnancy, thyroid, PCOD, PCOS, harmonic imbalance, infertility. I'll going to cover the theory. We have separate anatomy teacher. She will come and she will teach 2 classes. And I will be the backup, no problem. Asanas I'm going to teach. Okay, means pelvic exercise and how the Kegel exercise will work, deer exercise will work, Ashwini Mudra, how it will work. Otherwise, what techniques we are going to, even from healing, massaging ear points, stomach massaging, navel, your vagina muscles, everything I'm going to cover for this 5 topics. Okay, this all again, it will take like 5 plus 3, at least 8 classes. Now, in meanwhile, you can draft your assignment for pregnancy. Okay. After this, I'm going to start postnatal. Is it fine with you? Otherwise, you want first to start with before pregnancy. Choice is yours. Okay. You let me know. No problem. In meanwhile, here I'm seeing ma'am.
Namaste for all and very good evening to one and all. My name is Rishita. I am from Tirupati.
Oh,
So,
very good.
ma'am, I'm free at Vishnu. Plus, I completed my MS Yoga also.
Great.
From last 1 year onwards, I am teaching yoga for the obesity patients. After delivery, after pregnancy, ma'am. Right now, the people are coming with PCOD problem, ma'am. How to cure PCOD problem? Uh, so I have to teach very clearly for them, and I have to explain for yoga asanas also.
Okay. Okay. So
So
you're
that
okay. You want to know about the difference between PCOD and PCOS mainly.
mainly that issues, and after pregnancy, so many people are suffering from the health issues also, like obesity or thyroid or something else. So I have to teach very clearly about that what they are suffering from and which asanas and which mudras it will help for them.
Okay, okay. Fine. Next. Please switch on your video so I'll get to know everyone. Ma'am, whoever I'm placing in the main screen, please. Ma'am. Ma'am, are you there? T-shirt parent is there. You're in mute. Ma'am, you're in mute.
Yeah, good evening, everyone.
Yeah, we
Can
are.
you?
Yeah, ma'am, we are
Yeah,
able to hear. You're
sorry,
playing.
sorry. Okay. Yeah, my name is Mona Lisa Singh Deo. I am from Thane, Mumbai, Maharashtra, and I have been teaching yoga since last 7 years. And recently, last 3 years, I have been teaching aerial yoga and aerial silk.
Wow.
The main problem why I have gone for this because people are now inquiring about pregnancy yoga, and I don't know anything about this, how to take the asanas and all this. So I have joined this group.
Okay. Okay, fine. Then,
Namaste, everyone.
oh, very beautiful smile.
Thank
Namaste.
you. My name is Sonal Anand, and I'm from Chandigarh. And uh, basically, I'm from a technical background. I have done BTech, MTech, and I have pursued. I have done my like job in this field only. So I was working as a professor in a college
Wow, okay.
earlier. Yeah. Now I'm having a daughter, 6-year-old daughter.
Mhm.
So, I've just left my job and I'm just going through these different yoga courses, and I've done 350 hours yoga TTC in 2016.
Okay, 2016.
Yeah, since then I'm taking online, offline courses, yoga courses.
Okay,
Yeah,
fine.
so now I wanted to enhance my knowledge in this field, prenatal and postnatal, because uh, I personally believe that this is very interesting field, because during my pregnancy also I've taken up all these techniques, I've done yoga, I've done meditation, and I've seen the effect. So my daughter, I can see in her that she is kind of different from other children. So I know that this is going to be a very life changing experience for all the mothers and
Okay.
all
Uh,
would
okay,
mothers.
sorry to interrupt you. I want to ask you one question. Okay, see, who is going to choose the baby, mother or baby? You understood my question?
Yeah.
when when a parent become a pregnant means that they're planning, and when she's conceived, like when the heartbeat comes, before heartbeat, like when we say like 4+1, like fifth week we are pregnant, then before 8 week like heartbeat will come. Those things I'll explain. My not only for her, for everyone you can I will explain you after your introduction. Okay, when she just I want to share or ask, like she said na, like her pregnancy journey also. That's the reason I kept this question here. Like, who is going to choose the baby? Parents will choose the baby or baby will choose the parent?
According to my knowledge, the baby chooses the parent.
Okay, why?
I whatever I have heard about this from my spiritual teachers and everyone, that especially the souls keep looking for such parents who are like
No, no, I'll give anyhow, I'll give answer. Almost.
this
Then
is what I believe, and maybe there are other reasons also and other answers also, but this is my personal experience that it is maybe it's both way communication, both way connection,
yeah,
but
like who are very good in theory classes, like anyone have idea about karmas? Sanchita Prarabdha, SPA, Sanchita Prarabdha, Karma Karma. So
okay.
I'm going to link that and I'm going to answer it. Put aside, okay? Now we will see remaining people. I'm going to answer this question today itself, okay? Ma'am, Dr. Imamon, please introduce yourself. If you guys will finish, then today syllabus topic I want to say. Ha, ma'am.
Uh, Hi, hello everyone. Can you listen me?
Yes, ma'am. Yes, ma'am. We are able to hear you.
Yeah, I am Dr. Hina Mori from Gujarat, Morbi. I am a gynecologist and I have joined this course because I want to help my patients to have a smooth journey throughout the pregnancy. And as you all know that the cases of PCOD, PCOS, obesity, and pregnancy issues are already increasing. So I want to help them and I want to know the knowledge about yoga and role of yoga in these situations. So I have joined this course.
Okay, ma'am. You're from which place, ma'am?
I am from Morbi, Gujarat.
Okay, ma'am. Thank you. Thank you. I'm going according to the screens what I have, okay? Hi.
Hello everyone. Myself Anjali from Nagpur, Maharashtra.
Okay.
And recently I just did 200 hours TTT course from Rishikesh.
Mhm.
And I'm a physical trainer also. So I do have clients for this prenatal and postnatal, like pregnancy clients. And somehow I am just also interested for like people who don't conceive because of some health issues and all. So just I want to help them also and to enhance my knowledge. I'm just here.
Okay.
Thank you.
Thank you.
Hello,
Namaste, ma'am.
ma'am. Can you hear me, ma'am? Hello, can you hear me, ma'am?
Yeah. We are able to hear you.
Hello, everyone. My name is Ishita Soni. I am from Gujarat, Halol, Pavagadh. Um, I am a yoga trainer, and right now I am going with my Dhanvantari Yoga Life. Actually, I have joined this course because I want to join this course because can I speak in Hindi, ma'am? Because I'm very comfortable for this language.
Okay. Hello, ma'am.
Good evening, ma'am, and everyone. My name is Aarti Rajpura. I am from Ahmedabad, Gujarat. Presently, I am staying near to Ahmedabad, not exactly in Ahmedabad. And I have also done a few yoga courses, like from Ministry of Ayush till level 3. And presently, I'm working with school as a yoga teacher, and I'm taking my classes for my friends and relatives in the evening time. And I wanted to learn more and more about yoga in different fields. For therapy yoga also I'm interested, for this prenatal postnatal also I'm interested. So slowly I'm taking up all the courses whenever I have time. So this is the reason I have joined this course.
In the online connection.
Yes.
Okay, ma'am. Thank you.
Thank you, ma'am.
Thank you.
Hi, good evening, everyone. Good evening, ma'am.
Good evening.
Yeah, I'm Dr. Ketki Kharosekar. I'm from Pune, Maharashtra. I have done my master's in physiotherapy and I've done certification in ANC, PNC exercise specialist and pregnancy yoga also. I run birth harmony, Garbha Sanskaar and pregnancy yoga clinic. I wanted to update my knowledge and have a teacher training course, so I have joined this course. I am looking forward for more pregnancy problem solutions, means SPDP pain, sciatica pain, patient with type 1, type 2 diabetes. These are issues I'm looking forward in this course also.
Sure, ma'am. Definitely those all topics will cover. More than that, it will cover. But just
Yeah.
now I saw the WhatsApp, I guess only 13 or 14 members are there. So I'll wait for till tomorrow to post a few material. Otherwise, again, keep on posting the same thing, you guys will confuse. Otherwise, I thought today itself I'll post the main concept I was thinking. Okay, then someone messaged me in personal also. For them, I have shared, I guess. Next. Hello, ma'am. Ma'am, are you able to hear me? You're in the main screen. Monita. The remaining all videos are off. Yeah, can you share?
Yes, ma'am. Good evening, ma'am. I'm Dr. Monica Pettiwal from Nagpur. Right now, I am in OPD only, so I'm having some disturbance with the patient.
Okay. No problem. So I guess you will
I'm a
right?
practitioner, and I am practicing Ayurvedic medicine. And recently, I am having a lot of patient ANC, prenatal and postnatal.
Mhm.
So I wanted to do this course for the benefits of my patient, and I found it very useful.
Okay, no problem. You carry on, you can. Okay. So remaining all videos are off. Let me go through quick introduction of this topic. Okay. Or anyone want to give your introduction, please let me know. I can pop up them. No. Yes. Fine. Mainly in this course, the difference of Garbha Sanskara and pregnancy yoga and pre-postnatal yoga teacher training program this is. Okay. Here mainly in which way you're going to learn means even for Garbha Sanskara 14 to 16 chanting mantras also I have given. I mean I had drafted in that way. Array, all videos are off. Then okay, I won't pop up my screen. At least few videos, then I can see smiley faces. Then I will think, right, someone are listening to me. Otherwise, it will feel difficult later when I start asanas. Okay. What is okay? I promise na for Sonal to give that answer. Then I'll go with syllabus what we are going to conduct. Okay. This is open question for everyone. Who is going to choose a parent or a kid? Anyhow, she gave the answer. I mean, her explanation. If anyone want to come up with your answers, welcome. Otherwise, I'm going to say, why to waste the time? Right, na, Sonal? Theek hai na? Okay. Here, mainly, if you believe or not believe, I want to, means with this topic when I start, so I want to go with little bit depth. Like, when we can predict our future, I mean, future birth or not, I cannot give guarantee. Like, we are not that much of saints. But for that also, if you want, suppose, I'm giving an examples. It's not pointing out of anyone. Just now we connected with, I don't know anyone also, okay? You want to nest Janma like a Brahmin family or some other, something, you had a wish, which you are not able to fulfill in this present Janma. I mean, the desire. You got my point? I'll use easy things so it will be easy for you. The desire which you had something and which is not able to fulfill. Just an example of textbook examples I'm giving. So you want in that way, so some area, some place like Brahman or a dance or a music, something you had. That wish is there inside and a person will die or something. And next Janma is same thing. Can you give guarantee? Can we give guarantee? No, right? How we'll know? Okay, next Janma is there, but we don't know now. Before Janma, I'm Smita. Then before Janma, what I am? We cannot predict, right? So for next Janma, what you can do it to get a better thing if you want, that homework you can do in this Janma. For that, so many things are there in yoga. I mean, like postures or pranayama or mudras, this, that means I can pick only one mudra, which is called as Dharma Chakra Mudra, the wheel. Dharma Chakra means wheel. The mudra looks in this way, which is really called as life-changing mudra. Okay, I'll pop up if anyone want, you can take this photo. This is not for prenatal, postnatal, just to introduction of before a soul entering into the womb, what is exactly going on in the mother or a father or their psychology, or when they feel like, I want this type of kid, I want this type of daughter. We'll have so many thoughts, right? If you start analyzing of thoughts, so many thoughts, good thoughts, bad thoughts, we will discuss later. This is the mudra. If anyone want, you can click the photo. Fine. You understood. When the mudra topic, I will tell this is fire. Hope you all know Panchabhutas. If you don't know, let me know. The chakra wise linking, I will help you. Not help, 1/2 an hour I'll teach you. In which way? This is not there in the syllabus for idea's sake. Here for this batch, out of the yoga people like doctors, natural, Ayurveda, different people are there. So here the 5 fingers connection of chakras, vayus, koshas, all thing. If you want also 1/2 an hour in a quick I can explain you. Same topic if you want I can teach for more than 3 to 4 hours. These are the 5 Panchabhutas, right? This is fire. Which chakra? Manipura chakra. Where it located? Here. So connect with which vayu, the air traveling. If basic yoga, you should have understand before pranayama, panchavayus, right? So fire is linking with which vayu? Samana. This is not linked with prenatal. Just I'm helping you where connection of the Om and all. We'll talk later. This is fire, Manipura chakra, Samana vayu. Okay. So like anyone having like indigestion, constipation and all, we'll work with this finger mostly in the mudras. So I guess everyone know what is meant by Ashtanga yoga of 8 limbs. So I'm not going with the basic of this. I'm directly jumping into the prenatal one. Is it fine, right? But pranayama I will cover not only prenatal, like Nadi Shuddhi, Shitali, Shitakali, those also I can do like a recap. Who can practice, when to practice, those all things. Okay. This is air. Air is where? Here heart, everyone know. So which vayu? Prana. These all things, now I'm telling you 2 points. If you want each chakra ke liye, I can talk like more than 54 points. But not that much. I can post the material. In class wise, try to link chakra, vayu, tridosha and kosha. Why I mentioned tridosha means in pregnancy, which dosha increases, the pregnant woman will be in the stable way. Vata, pitta, kapha. This is again like Tridosha doctors and Ayurveda doctors, they can easily say. In Kapha dosha, like in pregnancy, the journey will be the mostly increases. We'll talk step by step, okay? So this is air I said, right? Air is a heart chakra, heart element, anaka. So here which vayu? Prana vayu. So center here, right? This is midsection here. Coming to this is what? Throat. Finger wise, if we discuss in this way, but if you're sitting in this way, like Sukhasana or Vajrasana or Virasana or Siddha Yoni Asana, whatever the sitting posture, then later, upcoming classes, I will help you in which way. We will discuss from down to up, then it will become easy for you. Okay. Now, this is throat. Throat means what? All your emotions like happiness, sad, worry, desires, anger, sorrow, emotions versus like feelings. I guess yesterday only I post in my status. If it is there again, I will share. If not, we'll see. So thyroid, most if you see, if you Google it or research, out of 10, 8 are suffering with thyroid gland or thyroid, parathyroid, high. Even gents also like hypothyroid. Why? This is the chakra which is mainly deactive, like unblocking of our emotions. Stress, even see hair loss. One, I have no health issues, but I will agree with my stress. It's there. We should agree, right? So what this area will link for you? Here it will link for your penile and pituitary gland. I guess everyone have an idea of Ida and Pingla nadis, right? If anyone want, let me know. I will explain. Ida, Pingla, right, left. Ganga, Yamuna. Center is Saraswati. Okay. Otherwise, I'll do one thing to make you to more understand and more easy to clear. Before pranayama, I will cover the nadis also. Okay, fine. So here throat chakra, right? This throat, what actually will do? All for especially for the pregnant woman, her emotions. If her journey is a cry, like she's crying in pregnancy, or she laugh, what she is to behave, here are 9 months, the baby till 8 years, same. You can, I will use only one word, you can easily you draft whatever you want. Your shadow for next 8 years. Why I said 8 years? Earlier I used to mention like 10 and 11. Now for the kids, the puberty started so early, like 10, 11, right? Till that, a mother have a chance to change the mentality, the behavior, the psychology, what she want in from her home. You are going to learn all these techniques in meditation. I will cover. Wait. Here, this is thyroid. I must say that this one. Air in which it is traveling from here to it's traveling upward. Right now, when it is traveling upward, that air is called was Udana Vayu. Air is going upward direction. Okay. Then what left? 3 over. This is what? Mooladhara chakra, Apana Vayu, down to your anal muscle. When you're sitting, your cockbone is down, right? You're motioning around. Like we will say, like Ashwini Mudra, you do there, we will say, right? When you're sitting there, the root center, the root chakra, earth element, Apana Vayu, air is traveling downwards. That's why I told you come from down, it will be easy. That way, if I will discuss a theory or if I'm saying, I'll start with earth element. So it will become easy for me. Here in the finger waist we are discussing means it is in the here. Okay. And this is everyone know your belly button 4 fingers down. You calculate with your 4 fingers. Why I will tell you when the topic comes. The from belly button 4 fingers down water element means Swadhisthana chakra. Here what all organs will cover actually? Uterus, ovary, pelvic area, bladder, this all. So women health issues, any infertility, like harmonic imbalance or like PCOD, PCOS, which chakras we are going to work? We are going to work on your first and second chakra, means Mooladhara and Swadhisthana. So then you make them one next point, like Apana Vayu, then Swadhisthana, which Vayu? See here when we discuss, this is Udana, I said Prana, Samana, then Apana. Then coming to the Swadhisthana, I didn't mention any Vayu. That throughout your body it will travel Vyana Vayu. So when Vyana Vayu is traveling entire your body, in which way interlink it will work on your spine here also. So indirectly, directly you have to work for your throat. So in infertility of any woman, like whatever the PCOD, PCOS or harmonic imbalance, like egg count is less, otherwise stress levels means few mudras will act from the brain. Means this is PNS, SNS, CNS. This is center, this is para, this is systematic. Now this time I will repeat again. If you know, no problem. If anyone want, I will explain that. Okay. So coming to my point, why baby only choose the parent means 60 to 70% of her previous birth is matching to the present parent, then only they will choose. I will give the reasoning also here to make you to more easy and understand. At least few members will agree. Okay. Before that, I want to see few of the faces at least. Then otherwise only here I'm seeing Sonali face and Vasu and Anjali, only that. Okay, I told about my introduction, right? I lost my husband, just in one word. Think 1983, March 15, Vishakhapatnam, I born. I'm openly, I can say my age and all. It's not, giving my experience this much means, so definitely you guys can count. Okay. So same day, same place, same time. Not only me, at least 4-5 members will be like, suppose here, think like one is Bombay, one is Pune, one is Calcutta, whatever the place. On that day, on that time, on that spot, I mean, that city, not only we, right? At least come second 3 to 4 babies, I mean, the delivery will be there. You'll accept my first point? How many will accept? Give thumbs up. Whether it is in India or US, I'm not talking about US. US also, take any one city which you born, which you don't need to tell your age and all. Just I mentioned my example, so I told you. For me, not a problem. Okay. Then what happens? We'll come to that answer. Before that, I want to give the explanation. So you will agree. So my things is just I gave one word. I don't want to make my personal stories and all in the class. So if 4 more also same city, same place, same date, I mean like birth the place, but the time also I'm saying. I born morning before 5 o'clock. I don't want to say exact time. Same city also I'm saying. And same year. Sorry, everything. Then think 5 are there, I'm the one. Remaining 4 also, their lifestyle or their story, whatever the horoscope should be same or no. This is my question. Be free, friendly, say something. We will start the class from tomorrow. You don't need to smile and tell. Today only introduction I am going to tell you, like syllabus I am going to tell you, that's it. Tomorrow onwards, at least next 2 classes, that's the reason if I see the faces in that way means one theory, one practical I'll teach. Otherwise first 4 I thought I will go with the practical. But all serious ways only Vasu is smiling. Vasu, tell answer Vasu, whatever, no problem. Tell me, you're angry. Say yes or no, I won't say.
Yes, yeah, yes or no. I have to unmute first. So I don't have actually a precise answer to it because personally I have not really kind of related to what you're saying. So I'm having few doubts and all. Maybe in this journey I might get my answer. to
Okay,
that.
but my question was clear, right? You understood,
Yeah.
right?
Yeah, but I'm not able to relate to it, is what I'm saying.
Okay,
And
no
somewhere
problem.
I'm having my doubts.
Everyone has different stories. Okay, someone gave message like everyone have different stories. Then for that, can we go one more step? Why different stories? Their lifestyle is different, or their profession. I'm a yoga teacher. Okay,
Mm.
I'll go one more step depth. From basically, I'm not only yoga, I'm into art and dance form. I know 8 different styles of dance also. I learned 8 different kinds of dance for 8 to 10 years. Then that why I'm going little bit means so you can connect your stories, or next if you get any pregnant woman means how to analyze her case study. See, pregnancy practical, it's not difficult. I saw 1 2 profile photos just now before the class in WhatsApp. So super photos are there. But later I'll get to know, no, kiska photo means your head is down like me, my photo like that only. So asanas in pregnancy, it won't be difficult. But you should know her mental condition, her physical condition, her spiritual condition. To understand that, we are discussing little bit. You got my point? So if I am in totally in the dance form or art form, suddenly why I stop and I change into the yoga? Otherwise, that backup will be there, always hitting me. I want to become a good dancer or good classical dancer. I want to give good dance shows or something. It'll hit and I'll die, think. I don't know when I'll die. I'll die. So that will carry for next thing, right? You will agree or not? That carry back. But how my yoga journey started at the age of 6 years means my grandfather is a yoga teacher. He used to still like the village, teaching, those things and all. So in home, obviously, what they'll say, no, from childhood we are this, you stop that. So, but here, what is that imprint? It's like good or a bad. My feel is what? Inside feel, I want to do dance, but I'm becoming a yoga teacher. Right? Like that, here all 4, 5 stories are different, means in which way the stories are different. In which way you want to give the, I got here 4 messages, let me see, then I will answer it. Sanchita karma, paranta karma effects. Okay, some Dr. Hema, everyone's are different. I will tell you. Mine, I gave the date of birth, right? Thing 4 also same. Here, not like Sanchita Prarabdha, that for the womb I will tell you, but here in which way means at least your lifestyle of the karmas, not only the karmas. Karmas means mostly people will say 3. Even I also thought 6 years back 3. But when I finished my MPhil time, I came to know total we have 8 karmas. So I'm not going in the depth of that in like Bhagavad Gita, Krishna karma, Nishkarma karma and all. Means whatever your carry back means I can say A is equal to S plus P. Like max kind of formulas I can give you. So when why I have no brothers, 2 sisters. Why I have no brother? Hey, don't put question mark faces here. You are going to learn in this course. That's why you joined, right? So suppose here Vasu have 1 brother and 1 sister. Maybe think, I have no brothers. I have 2 sisters. Okay. I have no brothers. Why? Means whatever I did, when I did, where I did, with whom I did. That is what you are going to learn in this course. Okay. The stories are different. I am a yoga teacher. Think another girl, another lady is a lawyer or a doctor. Another is like middle class. Another is like a poor. Another is like a business. Another is a rowdy, kind of different. Why the lifestyle is different? Not only karmas, it is affecting entire your if anyone a little bit of depth knowledge of Brahma Sutras, 555, I'm not asking 555 to learn, the number at least 555. Why Garbha Samskara? Samskara means what? Garbha means what? Garbha means womb. Samskara means what? Next point I'll come. First, this question ke liye I have to give the answer, right? So the samskara in Brahma Sutras, 40 are there. To make you more easy, the Vedic means how yoga came, where the picture you know at least, right? Upanishads, Vedas and all, right? Like that, Brahma Sutras also. I'm going to send few screenshots. But when to send, I don't know. If all are there in the group, today only I can send. If all are not there, I'll wait for 1 or 2 days. Okay? Mainly from here, Brahma Sutra 555, explanation of the samskara, means Garbha Samskara. The second word I'm saying, Garbha means womb, that you all know, that samskara, okay? It is vein in quality of a person. What is, see, I don't know you all, my quality or my behavior, my habits, my mentality, like that. When a mother, when a lady want to become pregnant, in which way she has to be? When suppose she want the behavior of the kid, in which way? Everything she can change in her home. In which way? Now I'm coming the point. This is your body, right? Right, left, you are able to see my shoulders? At least right side of your body is your father's side. Left side of your body is your mother's side. Okay? If you don't know these points, you can note it down. Otherwise, you can take recording from the sir. Right side, I'm repeating again, father's side, which is for us like a heat generation in our body. Left side is a cool generation in our body. Usually in India, not only India, if it is in US also, Indian people are there, means I'm talking about Indian ladies. Now like generation change, like you all like little bit active like this only, it will good. Otherwise, if I say about my mom's time, your mom's time, your grandparents' time, like that. Think being a lady, what they will do on that time? Anywhere are working? No, right? Like life is like a sacrifice, compromise, adjust. If you won't agree in today's class, when I teach meditation class, you guys will agree. Otherwise, when you started teaching a pregnant woman, when she started crying, I mean her tears, definitely you will accept. Acha ma'am said on that day, you will realize. Why means when we will teach one or two students came back, then definitely you will feel happy. In my classes, they are feeling this much experience. Why means in women's spiritual journey is different. Her compare with her, if you can count now itself, what will say? This is the shoulder, this is underarm, right? If you are wearing blouse, you measure this size and this size. At least half inch will be different. You measure after class. Whether right or wrong, you tell me. Vasu, you understood? Based on your eyes, you have still confused what I'm saying. This is shoulder, this is underarm, right?
I'm understanding everything. It's just that my expression you can just ignore when I'm trying to focus very carefully, so they
Okay,
move.
okay, fine,
You
fine.
can ignore them.
Okay, but you understand my question, my point, right? What I'm saying. This one you measure. See, both hands won't be same. At least few people carry a half inch different hair. Few will be 1.5 maximum. Okay. Why means the reason is your right side of your body is a father, left side is a mother. Ganga, Yamuna, Saraswati. How it will work means right means not only your father, means your father, forefather, they're all the behavior. That's why when a baby is entering into the mother's home, the same time, suppose like 5, 6 parents are trying for pregnancy. Think 5, 6 couples are there. But why this baby only for this couple? What the like Sonali, right? Sonal. Huh? So almost her 60 to 70% of her previous birth is matching only, then only she'll pick this couple as a parent. That is first point. Is it clear with my point? If you feel like class is going little bit speed, let me know. I'll go slow also. No problem. Okay. Then second point, when that baby, I mean the soul is entering into mother's womb, still heartbeat came. The first is like 4 week, 5 week. Na? When the heartbeat will come before 8 weeks. We'll predict like 6.5 to 7 weeks. I'm going to send all the pictures, all the materials. You don't need to worry. When it is occurring into the mother's womb, like plantation time, okay, egg plantation time, what happens? On that time, till 37 or 38 week, every 2 weeks, pranayama will different, mudras will be different. Mudras in between it totally will change based on her health issues. That put aside. Mainly here, when heartbeat starts, what happens? Till 12th week, 13th week. See here, doctors also there, but I want to say one thing as being a yoga mentor. Now you'll be becoming a yoga therapist after 1 month or 2 months in pregnancy. You will get certificates, right? Don't count like 12 weeks as a first week, I mean first trimester, next like 24, next like 28 or 30 or whatever. Add buffer 2 weeks. Why means I'm saying when your periods are missing, plus they'll add delivery ke liye 10 days extra, like 40 weeks they'll count, right? Your asanas or pranayama or mudra or relaxation or yoga nidra, pregnancy yoga nidra is different. Yoga nidra or meditation will calculate 2 weeks extra plus buffer. You got my point? That's the reason asanas, when I'm teaching like 12, you can count like 13, 14 also, we can try that asanas. Okay. So what happens? first 12 weeks or 13 weeks or 14 weeks, the mother mentality in which way? She'll has the feel like miscarriage ke liye. Like maybe I'll be miscarrying. I mean, my pregnancy I may lost. So most of the cases, what? Not like miscarriage, like first trimester, right? So in which way you are going to build for the baby or mother? Already baby is entering into the mother womb, matching of 60 to 70% of her or his previous birth, right? Then what happens? In which way you are going to do? There only will start Garbha Samskar. Means after 12th week only you can start slowly asanas. Before that, like pelvic stretching we will start. Here the meaning of Garbha Samskara only I am explaining. When baby is entering into mother's womb, her matching of 60 to 70% of the parent. But the parent means father and mother. Both psychologists will be different. It's not same. See, friends, parents, sisters, everything is not same. In that way, your right side, I'm saying about a father, your left side, I'm saying a mother. Then think your forefathers of 7th generation, your mother side of 7th generation, then how much impact on your pregnancy. Then coming to my third point, if you calculate 100%, I mean like a big round of 100, like 100 marks, 50 kids previous birth, remaining 50, 25 from your father's side, 25 from your mother's side. I mean, say pregnant woman, think here in any pregnant woman as this. Her 100 में 50, the kid is bringing her previous birth. You understood that point? Remaining 50, 25 of present pregnant woman ka her side. Remaining 25, present pregnant woman ka husband side. You got my point? But 50, what I said? Previous birth. Now I'm coming the point. The mother is the first teacher. God already gave, that's why she became pregnant. But not you, me, or other like parents, in-laws, no. In pregnancy journey, she can change that 50%. In which way? Different healing techniques and meditation techniques. I told her till puberty. Like now I said like 8 years, like 10 or 11 you can count. Till puberty, she can, suppose she want her baby, I mean her kid, to listen to her. She don't like her mother-in-law or brother-in-law, co-sister-in-law, some example I'm giving it. But we will train in which way to love everyone. When the kid is growing, definitely they only get to know that this family member is not good, mummy ko ye nahi pasand hai. But usually when the pregnancy time, obviously we will be affecting with some or some like gossip, otherwise this happiness, unhappiness, so many things, the stress effects, right? So when a mother is a pregnant, she can change like with connection of baby connection meditation. Okay, Pancha meditation, Panchabhuta meditation, Navagraha meditation. Navagraha means, hope you all know in temple what all the Navagrahas, right? If you don't know, in the meditation class, I will tell that in your body, how we are connecting with Navagrahas, Sun, Moon, Mercury, Jupiter, with your body parts, with baby's body parts. We are going to meditate. Pancha means what? 5 Indriyas, skin, tongue, nose, eyes, ears, yours and babies. Why means we have to strengthen both mother and baby. The mother should not become like a panic or anxiety attack. When the panic and anxiety attacks, what happens? In her last trimester, the babies will be in anxiety period. Otherwise, see, I'll give you one example. A few houses, they'll say, my baby is dragging entire the house with a pen or a sketch pen. They'll make all the wall scratches and they'll do all those things, right? But we will say, no, hamara ghar mein, we didn't do anything. We have no habit. Why this my son is doing like that? We have no idea. That is not, we have no idea, but that is their previous birth ka behavior. So this kind of thing in pregnancy yoga, asanas we cannot change. In meditation, you're going to change. So all the previous births you're changing. So 50% will be empty. Who is going to handle that 50%? The mother will going to handle that 50%. In which way? In the good way only. Good or a bad? In which way she wants, she can change her baby like behavior, her like what to say, characteristics, whatever she can change with color meditation, mud meditation, so many things. Okay. So the 50% plus this 25%, her parents, sisters, brothers, these all things will be there. But this 50%, especially the mother's thing. Now you understood, when a mother is becoming pregnant, when the baby enter, heartbeat comes on that time, 60 to 70% of the previous birth is matching to this couple, they will choose this particular parent. Then next point, when after entering it, the mother and the baby connection ke liye, we will start doing in Garbha Samskara. Hope I guess all know Lord Parvati and Ganesha story, right? How Lord Ganesha came, Parvati, how she did the toy and the rest tomorrow I'll explain. Here, the 12 weeks we are going to do Ganesha Mudra Pranayama. Connection, I told you, connection. So that the way how mother is going to change the baby is more important. I told na samskara, garbha samskara. This samskara word came from Brahma Sutras of 555. Mein 40 sutras are there. This 40 only in the pregnancy sutras, but you're not going to learn. Just I'm giving the from where actually pregnancy came. How this like also told I will like Ashtanga teacher. But if I ask where Ashtanga came, who did Ashtanga yoga, what all the asanas name in Ashtanga. So definitely she'll tell Parisarita Padahastasana 4 variations. Like if you are good in that particular one subject, we will say, right? So in that way, this see without ABCD you cannot make sentence. You may feel 1 or 2 classes bore, but you should know, right? This to make more short, I can say. Hope you all heard about Gautam Maharishi. At least, if no, also no problem, I will send. This 40 samskaras of out of 555, 40 samskaras to make more easy. Now see, like power yoga, aerial yoga, like blind yoga, acro yoga, water yoga, how it came. Earlier it is not there, na? Just 20 years, 30 years. Otherwise, think 35 years plus it came. Nothing but modifications, variations, whatever you're doing. But if you ask, yoga is not only the physical exercise, what I feel personally, but we'll give a statement like body, mind, and soul. What is soul? What is mind? Definitely you're going to learn the difference between mind and soul. Mind have 10 steps. But if you go with Insta or Facebook, I'm not there in Insta, but I'm telling you, nice yoga pictures we will all will post, but none of them won't explain about real actually what yoga. When your mind is in your control, body will listen. But when your body is okay, mind won't listen. So how to control your mind only, it's more important. Right now, whether you all agree or not, I don't know. So how to analyze your mind to control means you should have an idea, clear idea about analyzing of your thoughts. When your thoughts are in your control, there is no worry at all. We'll have like a desire, anger, so many issues. General also we'll have, right? Coming to the pregnancy, definitely she'll have n number of thoughts. How I'm going to deliver a baby without any fear, without any miscarriage, without any back pain, without any contribution. But most of the cases, we are going to learn like contribution more. Out of my 80 asanas, like 30 asanas are plus for contribution, plus diabetes, like combinations. Why means pregnant woman, if she is suffering with contribution more, and then what happens, if the placenta is lower down placenta, complications I'm saying, then she will have a chance to get a piles. That she will suffer again in the post-pregnancy also. Okay, these things you are going to see in the class. Just I'm giving an outlines. Okay, come to again the sutras. From 40, it become like 16 now to make us more easy. Then who from where it means, this will call as Maharshi Vedas. Means to make more easy. This Shodras out of 16, healing chanting, I had made 14 to mantras with mudras you are going to chant like Naga mantra, Om Namah Shivaya. Otherwise like Ha, Ra, Ta, Sa, Na. Where it is affecting your body also I am going to tell you. Okay. Hope few of the members, I guess here, I'm seeing 20 members plus are there. Have idea about chakras, right? Like Mooladhara, Swadhisthana and all. Can you connect with musical notes of these chakras? Musical notes. Very simple. Sa, Ri, Ga, Ma, Pa. You all know, right? Come from the down, connect it. If you're interested, let me know. Each chakra I had drafted more than 54 points, like musical notes, gods' names, colors' names, characteristics, and all. So for your idea set to increase your knowledge set. This is not linked with prenatal. But why I said means this Garbha Samskara. Samskara means what? The knowledge what you are learning in the womb. Right? This is not linking with your asana or something like that. What you are linking means that spiritual knowledge, right? So I connected here music also. Why means this 16 out of 14 I have prepared one PPT. I'm going to share like a PDF. Okay. So all these mantras, how in a spiritual way, the mother and baby will enjoy. That is only the Garbha Samskar. Theory wise. Means if you ask me, I can say what is the in English we will say instead of this using the term in Sanskrit, the importance of yoga during pregnancy. Okay, why means you all joined for that purpose only, right? Importance of yoga during pregnancy. What mainly before pregnancy topic is different, but my topic is what importance of yoga during pregnancy. You understood, Vasu? My next slide is that only. That's why I'm picking her name. Maybe in each batch one or two like that. Then they'll reverse say, ma'am, I have disturbed. Ma'am, I have disturbed. Then obviously one or two members in each batch will become connected. Till now, like that, in each batch, 3, 4 are still they started teaching pregnancy classes also. I'm so happy. They will draft, ma'am, it is right or wrong. I say, okay, you can continue like that. But here my next slide is she is the one. So okay, during pregnancy, mostly like physical changes, mental changes, emotional changes. But Garbha Samskara, what I'm saying, emotional and spiritual, you're going to learn. Physical changes is what? Obviously, second month, third month, fourth month, tummy will increase. But what all changes? Till labor, what you're going to help her? Like pelvic floor muscles, otherwise, yoga means for first the basic point, what you will do? Benefit means you'll stay like flexibility, strengthening, core. But in pregnancy also, you'll give strengthening for the core. Tell me, anyone? Vasu, we can give from 22nd week to 28th week, you enjoy whatever you want to do. Like
No,
reversible.
I thought something else, then I said no, acha, something. Because when you said core strengthening,
We can do even pregnancy Pilates also, but not in the all the weeks. Okay, that means not end, start 23rd to 28th. Why means anterior posterior babies. Anterior baby will start listening to the mother voice and father voice from the week of 19th. Posterior will start listening from 23rd. So these are all in class I am going to explain, right? Then you will get to know. Here mainly physical changes like flexibility, pelvic, and even you need more careful on the uterus and the ovaries also, right? When the tummy in the 6th month, 7th month, it will enlarge, right? So what you are going to do? Half of the asanas they can't do means what type of asanas you are going to design. That is most important. Mudras like Shakti Mudra, Yoni Mudra, then Makara Mudra, Naga Mudra. We have a set of when classes going on, you'll get to know. Then mainly you have to teach in which way frequent urinal problems also will be there. Bladder issues. So fine. Last batch, I got one of the trainer asked, instead of remaining this 30, 30, 20, 20 mudras, can I teach only one mudra for entire the body? I said, already we have covered in that you are not drafting properly. Otherwise, I will tell the answer, Matangi mudra. But throughout the 9 months, if the client should be with you, then what you will do? Little bit, see, you're paying some amount and you're learning. That not only that amount you have to earn, but that if a pregnant woman joined from the 4th month, she has to take from 9th month. Based on the combinations of health only, you are going to change. But as a home practice, you can give definitely to her. It will be helpful. Matangi mudra, only one mudra will cover total 9 body parts. Parts means not like hand and legs. My thing is like organs, like liver, kidney, your digestion system, your pancreas means diabetic 1, 2. If you can't remember the mudra, so many things, you can pick nicely Matangi mudra, which can control the BP till pelvic area. For normal delivery means we have like apana, those things in mudras class. Okay. See here, mainly relaxation, I guess everyone know instant, quick, deep relaxation. That also I will teach. Yoga Nidra is set is different. Okay. And pelvic muscle strengthening for delivery, for labor, we have one or two different technique. Anyone are interested to know the gender before delivery? In India, we won't say, but US they'll say, right? But I can tell you the gender also, if you are interested. Wow, she's saying, wow, I understand. Psychologist, right? So my topic will be interesting for you, I guess, also. So, but without absent you attend, if anytime if you're absent, please follow the recordings. Okay, that one homework you will do, definitely you'll get to know. Why means later when you start, in your area there is no pregnant lady, you will become popular like me. In Bangalore, in Electronic City, I'm the only one lady from past 10 years teaching pregnant. So you'll become like a monopoly there, obviously. Most of the people doesn't know with the Smita. They know like Swarna Kamal Smita means they're like, now Swarna Kamal yoga teacher, madam. Okay. Her flat is that you can take right up fourth floor like that, they'll tell. Send means that yoga center name, they will identify in that way. Okay. So in this topic, mainly in which way? Tomorrow we can discuss. You all will agree if pregnant women will suffer with the breath issues. I'm not comparing. In Corona, why most of the people suffer with lungs issues? Means you need a proper oxygen, carbon dioxide, right? For that, small techniques you are going to learn. That even in your regular class also, you can teach not only for infertility. General like, why means oxygen and carbon dioxide for mother and baby should be most important. Until unless that is not stable, you cannot predict how the pulse, right? Why means if the BP is high or hypertension, we have a chance to miscarry in 31st and 32nd week. You may ask, like you said before 12 weeks or 13 weeks, now why, how can you pick 31, 32? It depends upon the BP. Like 2.5, 3 years back, I met one client. For her, that is the first pregnancy from Dallas, the online only. She lost her baby in the week of 31 week 40 days. Mother is fine, baby lost in the womb in the 5 days. But her body was super fine. Doctors got shocked. She went for her checkup. Next day's baby shower. She planned everything. Then doctors got shocked. How come you are like alive? Your baby passed away 5 days before. Immediately she joined in ICU. Here means they do C-section. They did normal delivery. After that only, she told, 1 hour back only I did my online class and I came. They contact me from the same hospital. I got 40 plus students. They were wondering, baby she lost 5 days before. Mother body was okay. Now after that, we'll have depression kind of thing, right? She lost her baby, right? Yeah. This is one of the bad experience which I faced out of so many clients. Then she trusted me. What is the issue? I asked her, which triggered more? Her case was handling with diabetes. See, diabetes and hypertension and thyroid. Even though I made as a normal delivery, she lost a baby. Then she called, she cried, everything done. Then within 5 weeks, she joined in the normal classes. Again, within 5 months, she became pregnant, 5 to 6 months. Can send you one photo in the group. Now she blessed with a baby girl with a normal delivery. That's what yoga you can learn it in pregnancy with different. Then I realized, okay, 31, 32nd week also we should be in a way to calm her hypertension. That's why in pregnancy, pranayama, breathing techniques are most important. Lungs, oxygen, carbon dioxide. That should not shoot up and down. High BP means what all complications. Low BP means what all complications. Anxiety means stress, what all things. This all you are going to learn in this syllabus. Means these are the physical changes. This I'm not saying is a mental or spiritual changes. You understood the difference, right? Physical changes like balancing of blood circulation, how you are going to make the improvement of immunity power in a pregnancy, and back pain I'm not mentioning, anyhow you're going to learn. So that is not what I feel like a major issues in the pregnancy. Definitely ending comes, definitely they'll have a back pain. Everyone, we all know that. So here, even like vertigo vines, like VV will say, like leg down, calf muscle care, like blue color, violet color, this tissue damages and all. How to work for a pregnant woman to cover, instead of breaking the head in 31, 32, 34, you add few mudras, Jalasokini mudra, water balancing mudra, asanas like a reverse warrior, like Veerabhadrasana too, you know, right? In that, you're raising your hand, placing other hand in the down. few asanas will work to control the means water intake. Normally, what we know, like 70% is body of water intake. If water is not proper, means unblocking, then usually what will be hands, legs, face, and all in the last trimester swelling, right? Then after that swelling, other issues, what even the thighs, knee, calf muscle, from 24th week onwards, it will start slowly, vertigo veins. So for this, why to wait till that you start giving your techniques of the mudras to control in a proper way for preventing. This course is what? To preventing. To add up in a better position so that it won't be any risk point. That's why I told, na? Earlier, like I wrote for asthma different also. I covered in which way the risk points also when we teach, then automatically the client will have confidence on you. Right now? You agree? Then mainly, I can say here, you all will agree, not only pregnant lady, general also, our blood circulation, heat circulation, air circulation, nervous system should be in a proper way. These words I used, right? Can anyone connect into yoga? What are these things? Already you're saying like 9-10 hour, ma'am didn't leave, she started the class itself. I'll stop. Just I'll tell the syllabus headings and I'll stop. Nothing but Vata, Pitta, Kapha. Okay. Ayurveda is not my topic, but little bit outer lines I can cover it, no problem. So, okay, we'll see this topic tomorrow from starting of the before pregnancy and during pregnancy. Importance of yoga during pregnancy, we'll start from tomorrow. But let me explain you the syllabus first, what I am going to cover in 34 or 35 classes. And then the pregnancy journey I'm going to cover. And asanas 82 I'm going to cover with the complications, risk and all. Pranayama 20 or 22 I'm going to cover. In that, general pranayams are 8, like Nadi Shuddhi, Shitali, Shitakali. But Shitali, Shitakali, cooling places you are not supposed to teach. Winter you are not supposed to teach. Rainy you are not supposed to teach. So I'm going to do those revision. And that's why I told them total 2022 means 8 or 10 are normal revision, remaining like prenatal different. Okay? And mudras we'll see how much I can add up also, not like 20, we'll see like 30 also, no problem. Then coming to healing and chanting, that is most important, right? In each 2 weeks, what kind of healings you are going to do, where you are going to massage, what you are going to do, where you are to stretch these things. Otherwise, liver means right chest down, liver, placing your right hand, left hand, right chest down, liver position. Then which mantra you are to chant to strengthening your liver. Suppose the client is IUF or IVF, she can't do asanas, she'll be in bed rest, but she need a peace of mind for her stress. So you can use this type of techniques. It will be helpful, right now. Then mantra yoga, I mean chanting and all. Then in Surya Namaskar, I guess all who are here, yoga teachers, you all know like that what we know Surya Namaskar, but pregnant women can't do in that way. But here I am adding Vinyasa flow of 3 different styles with different weeks. Got it? First week, few set of asanas we can't do. I mean first trimester. So Vinyasa flow of Surya Namaskar of different style, like a flow, you are going to learn 3. Based on what I will wrap, you can change with your style of asanas. Okay, you can use the block and all, you can change. Okay. Then after that, understanding means prenatal ke liye I covered the topics, I mean syllabus I'm telling. Next, understanding of your reproductive system. Here, I guess whether she's there or not, I'm not sure. She told her like PCOD, PCOS different and all means you should know the idea of your reproductive system. Right? Without understanding about your reproductive system, we cannot guide further like what your pelvic is going or your uterus is working, how your egg means, where the plantation. So we'll make you understand the anatomy of, and psychology of pregnancy and childbirth before that reproductive system. Okay? So if anyone want to miss, don't miss practical classes. Theory class means at least by videos you can. But if you attend, then you will get more doubts. Okay. And prenatal, I forgot to tell you one thing. In labor, I told na gender boy or a girl also I'm going to relieve. So for that, 1 or 2 techniques are there. Labor meditation, labor practical. Okay. That will be the last topic for the prenatal. But that topic I'll teach last, not first. First I'll cover entire pregnancy. Then I'm going to teach you understanding the reproductive system, anatomy, and psychology of a birth and the child in the pregnancy and all. Coming to before pregnancy, like thyroid, why thyroid issues? T3, T4. What are the asanas to cover? Suppose we'll say Sarvangasana, Halasana. Thyroid it will work. But she is planning for pregnancy. Why Sarvangasana, Halasana? You're lifting up, that's why your thyroid gland is working. No, you should understand the air which way it is traveling. But if she is planning, think first month, okay, you will give. Next 2 months, she may conceive anytime. Then Halasana she can do. No, she can't do Halasana. So in which way you are going to change the asanas? So normal thyroid, if you want to teach, I'm going to help you. But with the thyroid, she is going to planning for pregnancy. In which way you are going to change the asanas? Why today class was little bit delayed, I mean extending. In which way I'm going to cover the syllabus, you should have an idea. Tomorrow onwards, exact 1 hour, 2 minutes or 1 hour, 5 minutes. By 9:05, I'm going to stop. No problem. So today only. So later, ma'am, you missed this point. You cannot say. Whatever today I'm saying, everything I'm going to put. PCOD, PCOS, asanas, pranayama, mudras. Like the thyroid asana, pranayama, mudra. Harmonic imbalance, asana, pranayama, mudra. This is before pregnancy. Okay. Postnatal, what happened usually for women? We'll stop in 2 minutes. The belly will become loose right after delivery. Everyone agree? Either it is a C-section or a normal. So it is a C means total how many layers will cut? 6 layers, right? To patch up the 6 layers to become a normal figure, how much time it will take? I'm not talking about body shape. At least for fitness. Fitness means not again gym fitness, her regular health. Okay, her regular health, again, at least she has to do her work to strengthen her back pain and stomach and all. So we'll say like abdominal muscles to understand you. But we have one word is there. We call it DR muscles, DR rectal muscles. I'll post 3 different kind of belly on that. Otherwise, if all joined, entire material, if you want to post, Sunday only I'll post. But you'll get confused. Step by step, I'll post. Okay. That muscle strengthening, again, we will do total 22 asanas. Plus Pilates, I'm going to add at least 14 to 18 exercises to contracting your abdomen, to tuning your abdomen. So Pilates plus yoga, yoga lights, it is 1 class. And 2 classes for when to start after 48 hours later, which asanas you have to do. Otherwise, what for breastfeeding, what kind of asanas will help, like Anantasana, PG, and when to add. After 74 hours, what to do and all. Not only this, apart from that, I want to cover one more thing which I found. Yes, teaching methodology. At end, you will have doubt, na, ma'am, you are done with the syllabus. Now you'll say Tata bye bye means how I have to plan 1 hour class or 30 minutes class or 40 minutes class. Right? So this way I'm going to cover. If you want for the proper nutrition thing, means we have a Dr. Srileka. I can ask her. So based on, suppose my body is kapha body, your body is pitta, and her body is vata. Think. In that way means what food you are going to draft. That also you should know, right? People will say, okay, eat ghee, otherwise you do this, you do that, we will tell that. But I don't want to fool like that. It depends upon totally on your body type. Right now? So how you are managing the lifestyle and asana, this I will help you in the physical or mental or spiritual. But coming to your food and all, based on your body type it required, especially in the pregnancy, you have to take care. We'll say, no, don't eat junk food. You can eat based on the food type. I mean, based on your body, what it required. So if you want next week or following week, I can engage her. That class, you can listen and you can ask. Before she before she start your class, I'll tell you 2 days before only, so and so date, Dr. Srileka will come. So you please draft all your doubts to ask her. Once she left, if you ask, I can't give answers. I'm not in that. So I can't give answers. So my role I will do. So before that, at least weekdays or 8 days, we will cover our things. Then I will tell you. In meanwhile, Ayurveda topics, what you have to want and what to maintain, you can ask her. Any doubts in the syllabus wise? The role of Garbha Sanskaar also you are going to learn, mother and child bonding to maintain how the body protocol and oxygen levels and immunity system. This is the syllabus I'm going to cover. Now, anything else you want to add, please let me know. Or we can wind up.
I have
Will we have exams?
You won't have exam, but I can tell you one thing.
Mm.
First two batches, what I did means, the batch was 34, 40 and all. I gave like 20 minute session for everyone. Like that, like suppose I gave you topic in pregnancy, diabetes, think some other like what topic you going to draft. I told them that's the reason I'm doing first pregnancy, then I'll start before pregnancy topic. You can start drafting, right? In the 20 minutes, if you teach 5 asanas for me also fine. By means already you are good in asanas. Here we will do with a modification like backside you are see like blocks, pillow, so many things are there, ball and all. So simple thing I'll tell you, table, sunboard, whatever. Those posters, how it will work, caterpillar, means gate and half circle you're doing in the 28th week to 32nd week. That works for lungs and constipation and digestion. I told the 3 organs, but when class goes, I'll tell Samana, Vyana, and Apana. Then think 3 vayus are going. Then in which way? To contra again, you have to relax and caterpillar. That caterpillar, if you're sitting for 10 minutes relaxing, even it good for normal delivery to turn the bridge baby and frank baby to the posterior or anterior convert. So I'm going to explain, Vasu, don't get scared. So 3 or 4 asanas you can show me if you want. But last 2 batches I didn't place anything. They want to finish the course, they want certificate, and hardly 5 or 6 members they did assignments or case studies. So definitely I will feel that 5 or 6 members will shine. Why means when you have doubt and you started drafting, you will get to know what. So then now onwards, like if you want exam, I can conduct. Otherwise, case study, any one case study for pregnancy, any one case study from post-pregnancy, you can prepare and you can draft. And you can send through WhatsApp. That is only for your knowledge sake, so whether you are drafting in a proper way. Some mistake and why you are doing this course. Later you want to start your career to add up one more course, right? So in that way means see, this is not like, I don't want to force anyone. If you want to do, I'll conduct. If you don't want to do assignment. Enough. Your assignment is wrong, I will help you. Not only that, if you are be with me for later, I can help you to correct. But mostly like Tuesday, Thursday, I can reply more. Monday, Wednesday, Friday, I'll have 14 to 16 classes. Different. I'm handling 14 countries. That's the reason. Okay. So my day starts morning 5 o'clock, 4:30. I'll get up at 3:30 and my day end with your last class. Anything else? Any doubts? Or shall I wind up?
Ma'am, will you cover some medicine part also in this course?
Medicine means tablets you're asking? That is not my part. My topic in my PhD also, my articles are stress. If a woman in stress in pregnancy, how to overcome the stress and what asana or pranayama mudra you're going to give for stress and how she will become to normal delivery. Okay, but general what for your material I have drafted for complications for 14 topics, like in which way, like vertigo wine, high BP and diabetes, heart problem. If general like like IUF, IVF means what we had to do like that. So here 1 or 2 beautiful faces are there, like face was beautiful, but
Madam,
sir.
Madam, I'm Sri Lankan. Can you tell about the chakras related to about fingers?
Yeah, definitely. I can, if you want, I can post each chakra ke liye 54 points. But let me check it is there in my WhatsApp or not. If not there, I will check it from my laptop. Because just 10 days back, my mobile thoda sa kharab ho gaya. Otherwise, who are in touch, I told, na, old students, if anyone are there. If no, you want general point, one day I will connect chakra with vayus, with koshas, with pranas, with tridosha. I guess this is more than enough, right? Chakra, koshas means what? Annamaya kosha, manomaya kosha, vijnanamaya kosha, anandamaya kosha, right? Annamaya kosha is first kosha, right? This Annamaya kosha is linking with first 3 chakras, like that. Same, first chakra is what? Mooladhara chakra. So Mooladhara chakra, which vayu? Apana vayu. Which kosha? Annamaya kosha. Now coming to Tridosha, Vata Pitta Kapha, which here? Kapha dosha. Like that, one day we can cover, sir. No problem. You can put it out your questions. If it is out of pregnancy, one day I can cover. If it is in pregnancy topic, happily I will cover. No problem. Anything
Thank you
else?
very much, ma'am.
Okay, sir. No problem. Anything else? Shall we wind up? You like the class? Yes or no? No? Oh, here I'm seeing she's smiling. I'm happy today. See, we can place her photo here, then we can stop. Otherwise, who is good in one photo? Can group photo? First class again, we'll see in the last class also. Can anyone click one photo?
You don't know how to.
Don't know. Even I too don't know. That's the reason I'm asking you. No one. See, one in each batch, I want one photographer and 3 students to do along with me. In each day, 2 students will be doing with me in the practical, 1 photographer. Why means, I will tell you, recordings who are not following each asana with variation else shown, one who will click the photo, you can drop 18th week to 20th week. This is the thing. Last 2 batches, 2 students did like that. I really appreciate. It will become easy for your next class. So 1 photographer and 2 or 3 assistant trainers like with me to do the asanas. So among you, photo. Like small kids will say, no, huh? No means tell me I will close the session. Yes sir, no, something, smile. Sir also not there. Who is clicking? Please tell me. No one.
Ma'am, if anyone have laptop,
Taken a screenshot. I'll share in the group.
Okay, you did. You
Yeah.
did. Yeah, fine. So who all in the group, please let me know. If you want me to share the PDF, first one, total 135 pages, I will share. No, people I have to add, means tomorrow I will share. Okay. So you please, who all are there in the group, drop the message. Tomorrow you have class or not. If there is class, usually your class will be Monday to Friday. No Saturday, Sunday. Okay. Fine. Chalo, bye. I'm winding up. And I'm going to share this recording in the group, or not in the group. I'll post in Sar account of YouTube. He is going to post in the group. Okay. Bye-bye. Thank you.